Hello everybody, welcome to Living La Vida Longer. Here you will find the secrets to increasing lifespan and longevity. High blood pressure, also known as hypertension, is a common but serious condition that can lead to heart disease, stroke, and other health complications if left unmanaged. According to the World Health Organization, hypertension affects more than 1 billion people worldwide, making it a critical public health issue. One of the most effective ways to manage and prevent high blood pressure is through a healthy diet. While incorporating nutrient-rich foods can help control blood pressure, it is equally important to avoid certain foods that can exacerbate the condition. This video aims to shed light on 5 specific types of foods that individuals with high blood pressure should avoid. These foods can contribute to increased blood pressure, making it more challenging to maintain a healthy cardiovascular system. By being aware of these dietary pitfalls and making informed choices, individuals can take proactive steps towards better heart health. Whether you have been diagnosed with hypertension or are simply looking to prevent it, understanding which foods to limit or eliminate from your diet is essential. Join us as we explore the 5 key foods to avoid for maintaining optimal blood pressure and promoting overall well-being. But first, make sure to subscribe to the channel so we can help you live a longer, happier, and healthier life. With that being said, let's discuss 5 foods that contribute to increased blood pressure. Number 1. Excess caffeine. Caffeine is a natural stimulant found in various beverages and foods, such as coffee, tea, energy drinks, and even chocolate. While moderate caffeine consumption can be part of a healthy diet, excessive intake can have negative effects, particularly for individuals with high blood pressure. Caffeine stimulates the central nervous system, leading to a temporary increase in heart rate and blood pressure. For those already dealing with hypertension, this spike can be problematic, exacerbating their condition. Research has shown that caffeine can cause short-term increases in blood pressure even in people without hypertension. This is because caffeine blocks a hormone that helps keep arteries widen, while also causing the adrenal glands to release more adrenaline, a hormone that further increases blood pressure. The extent of these effects can vary based on individual sensitivity to caffeine and the amount consumed. High caffeine intake can come from various sources. A single cup of coffee can contain anywhere from 70 to 140 milligrams of caffeine, while energy drinks can pack a much higher concentration. Regular consumption of these beverages, especially in large quantities, can lead to sustained high blood pressure levels, posing long-term health risks. For individuals with high blood pressure, it is advisable to limit caffeine intake to moderate levels. The American Heart Association suggests keeping caffeine consumption to no more than 200 milligrams per day, roughly equivalent to 2 8-ounce cups of coffee. Alternatives to high caffeine beverages include decaffeinated coffee, herbal teas, and other low-caffeine drinks. These options can help manage caffeine intake without compromising the pleasure of enjoying a warm or refreshing beverage. Number 2. Salty snacks. Salty snacks are a ubiquitous part of many diets, often consumed for their convenience and taste. However, these snacks are a major contributor to high sodium intake, which can be particularly detrimental for individuals with high blood pressure. Sodium is an essential mineral, but in excess it can lead to fluid retention, increasing the volume of blood in the bloodstream and consequently raising blood pressure. Common salty snacks include potato chips, pretzels, salted nuts, and popcorn seasoned with salt. These foods often contain high levels of sodium, sometimes exceeding the daily recommended limit in just 1 serving. The American Heart Association recommends no more than 2,300 milligrams of sodium per day, with an ideal limit of 1,500 milligrams for most adults, especially those with hypertension. Consuming salty snacks can quickly surpass these limits, leading to elevated blood pressure and increased risk of cardiovascular diseases. High sodium intake not only affects blood pressure, but can also strain the kidneys, impairing their ability to remove excess fluid from the body. This fluid retention can further contribute to high blood pressure, creating a vicious cycle. Additionally, many salty snacks are also high in unhealthy fats and calories, contributing to weight gain, another risk factor for hypertension. Before we continue, here's a video on detoxification you should consider. Watch 8 foods to detox your kidneys naturally. Now back to our discussion on 5 foods that increase blood pressure. To manage blood pressure effectively, it is crucial to limit the consumption of salty snacks. Healthier alternatives include unsalted nuts, air-popped popcorn without added salt, fresh vegetables with hummus, and whole grain crackers. These options provide the same convenience and satisfaction without the excessive sodium content. Number 3. Sugary beverages. Sugary beverages, including sodas, sweetened teas, energy drinks, and certain fruit juices, are popular but detrimental choices for individuals managing high blood pressure. These drinks are often loaded with added sugars, which contribute to a range of health issues, including hypertension. High sugar intake can lead to weight gain, insulin resistance, and metabolic syndrome, all of which are risk factors for high blood pressure. Consuming sugary beverages can cause rapid spikes in blood sugar levels, leading to a surge of insulin release. This process can increase sympathetic nervous system activity, which in turn raises blood pressure. Over time, the regular consumption of sugary drinks can result in persistent high blood pressure, posing serious risks to cardiovascular health. Research has consistently shown a link between high sugar consumption and increased blood pressure. A study published in the Journal of the American College of Cardiology found that high intake of sugary beverages is associated with higher blood pressure levels and a greater incidence of hypertension. This association highlights the importance of reducing sugar intake as a strategy for managing blood pressure. Replacing sugary beverages with healthier alternatives can significantly improve blood pressure control. Water is the best choice, as it is calorie-free and supports overall hydration. Herbal teas and infused water with slices of fruits or herbs can provide flavor without the added sugars. Diluted fruit juices with a higher proportion of water to juice can also be a better option than full sugar drinks. Number 4. Fried and processed foods. Fried and processed foods are staples in many diets due to their convenience and taste, but they pose significant risks for individuals with high blood pressure. These foods are typically high in unhealthy fats, sodium, and calories, all of which can contribute to elevated blood pressure and overall poor cardiovascular health. Fried foods such as fried chicken, French fries, and donuts are often cooked in oils that contain trans fats and saturated fats. These fats can lead to plaque buildup in the arteries, narrowing them and making it harder for the heart to pump blood. This condition, known as atherosclerosis, directly contributes to increased blood pressure. Additionally, the high calorie content of fried foods can lead to weight gain, another key factor in hypertension. Processed foods, including deli meats, sausages, and ready-to-eat meals, often contain high levels of sodium used for preservation and flavor enhancement. Excessive sodium intake can cause the body to retain water, increasing blood volume and consequently blood pressure. Processed foods can easily exceed the recommended sodium limits, making it challenging to control sodium consumption. To manage high blood pressure effectively, it is crucial to reduce the intake of fried and processed foods. Opting for baked, grilled, or steamed alternatives can significantly lower unhealthy fat intake. Fresh or minimally processed foods, such as lean meats, whole grains, and a variety of fruits and vegetables, are healthier choices that support cardiovascular health. Number 5. Alcohol. Alcohol consumption is a common part of social activities and relaxation for many people, but it can have adverse effects on blood pressure, particularly when consumed in excess. Even moderate drinking can raise blood pressure temporarily, and habitual heavy drinking can lead to sustained hypertension. Alcohol affects blood pressure through several mechanisms. It stimulates the sympathetic nervous system, which can cause blood vessels to constrict, leading to higher blood pressure. Additionally, alcohol can interfere with the effectiveness of blood pressure medications, complicating treatment for those already managing hypertension. Chronic alcohol consumption can also lead to weight gain, liver disease, and other health issues that indirectly contribute to high blood pressure. Before we continue, here's a video on liver health you should consider. Watch 10 Skin. Warning signs of liver disease: liver cirrhosis, fatty liver. Now back to our discussion on 5 foods that increase blood pressure. Studies have shown a clear relationship between alcohol consumption and elevated blood pressure. For instance, a study published in The Lancet found that reducing alcohol intake can lead to significant decreases in systolic and diastolic blood pressure, highlighting the importance of moderation. The American Heart Association recommends that men limit alcohol to no more than 2 drinks per day and women to no more than 1 drink per day to minimize the risk of hypertension. For individuals with high blood pressure, it may be beneficial to limit or avoid alcohol altogether. Healthier alternatives include non-alcoholic beverages such as sparkling water, herbal teas, and mocktails. These options can provide the social enjoyment of drinking without the negative impact on blood pressure. Managing high blood pressure is crucial for preventing serious health complications like heart disease and stroke. Diet plays a significant role in this management, and being aware of foods that can exacerbate hypertension is essential. By avoiding excess caffeine, salty snacks, sugary beverages, fried and processed foods, and limiting alcohol intake, individuals can take proactive steps toward better blood pressure control. Please note that this video is for educational purposes only and not intended as a replacement for professional advice. Remember to consult with a healthcare professional before making significant dietary changes, especially if you have existing health conditions. We hope you gained a ton of knowledge from this video. Don't forget to share it with everyone you care about. Thank you for watching and see you in the next video.